Hello everyone, this is your channel where you will get important health informations. Today we will be talking about hepatitis B. What is hepatitis B? Hepatitis B is an infection of the liver caused by the hepatitis B virus, HBV. It can be acute and resolve without treatment. However, some forms can be chronic, and these could lead to cirrhosis and liver cancer. Who has it? About 850,000 to 2.2 million people in the US have hepatitis B. In 2016, almost 20,000 people in the US were newly infected with hepatitis B. In California alone, there were over 750 newly reported cases in 2016. Hepatitis B is not as common as it used to be among young people because there is a vaccine for it. HBV is a major global health concern. In fact, in 2015, HBV-related liver disease caused around 887,000 deaths worldwide. How do you get hepatitis B? The hepatitis B virus lives in body fluids like blood, semen, and vaginal fluids. If you come into contact with a hepatitis B infected person's fluids through unprotected oral, vaginal, or anal sex, you could get hepatitis B. You can also get hepatitis B by sharing needles, drugs, nail clippers, razors, or toothbrushes with someone who has the virus, or by getting a tattoo or piercing with infected tools, or when a woman with HBV gives birth. Health workers may be at risk through unsafe medical practices, such as reusing medical equipment, not using personal protection, or incorrectly disposing of sharps. HBV cannot spread through food or water, shared eating utensils, breastfeeding, hugging, kissing, holding hands, coughing, sneezing, insect bites. The virus can survive outside the body for at least 7 days. During this time, it can still cause infection if it enters the body of a person who has not received vaccination against it. What are the signs and symptoms? Many HBV infections occur during infancy or childhood. This is because a mother can pass HBV to her child during childbirth. However, doctors rarely diagnose HBV in childhood, as it causes few obvious symptoms. Symptoms of a new HBV infection may not be apparent in children under 5 years of age or in adults with a suppressed immune system. Among those aged 5 years and over, around 30–50% will show initial signs and symptoms. Acute symptoms appear around 61–50 days after exposure to the virus, and they can last from several weeks to 6 months. A person with a chronic HBV infection may have ongoing episodes of abdominal pain, persistent fatigue, and aching joints. Early symptoms. If HBV does cause symptoms early on, they may include fever, joint pain, fatigue, nausea, vomiting, loss of appetite, abdominal pain, dark urine, clay-colored stools, jaundice, or yellowing of the skin and whites of the eyes. Many people who have hepatitis B don't know it. They may feel fine, or they may just feel like they have the flu. Some people have these symptoms. How do you test for hepatitis B? Your doctor will do a simple blood test if he or she thinks you have hepatitis B. Can you get rid of hepatitis B? There is no cure for hepatitis B, but in some people, it goes away on its own. Some people have it for the rest of their lives. There is medicine that can help the liver of people who have chronic hepatitis. Even if you don't have symptoms, you can still pass it on to others if you have unprotected sex with them. How can you protect yourself from getting hepatitis B? The best way to avoid hepatitis B is to get the vaccine, which is a recommended vaccine for babies. If you haven't had the hepatitis B vaccine, you should let your doctor know. Condoms may also be helpful in preventing hepatitis B from spreading. What's the worst that could happen? You could pass it on to your partners, even if you don't have symptoms. Hepatitis B infection also increases your likelihood of getting HIV. Chronic hepatitis can lead to liver damage, cancer, or even death. Hepatitis B versus hepatitis C. Hepatitis has many different types. HBV and the hepatitis C virus, HCV, have both acute and chronic forms. The main difference between HBV and HCV is how they spread from person to person. Although HCV is transmissible via sexual activity, this is rare. HCV usually spreads when blood that carries the virus comes into contact with blood that does not. Hepatitis B during pregnancy. If a woman with HBV becomes pregnant, they may transmit the virus to their baby. Women should inform the doctor who delivers their baby that they have HBV. The infant should receive an HBV vaccine and HBIG with 12-24 hours of birth. This significantly reduces the risk that they will develop HBV. The HBV vaccine is safe to receive while pregnant. A little more about the vaccine. A vaccine against HBV has been available since 1982. People who should receive this vaccine include all infants, children, and adolescents without a previous vaccination, all healthcare workers, those who may have had exposure to blood and blood products through work or treatment, people undergoing dialysis and the recipients of solid organ transplants, residents and staff of correctional facilities, halfway houses, and community residences, those who inject drugs, people who share a household or engage in sexual intercourse with someone who has a chronic HBV infection, those with multiple sexual partners, people who travel to countries where HBV is common. Schedule. The HBV vaccine takes the form of 3 injections. A person can receive the first injection at any age, but babies should receive the first injection soon after birth. The second shot should occur at least 1 month after the first. Adults can receive the third dose at least 8 weeks after the second dose and 16 weeks after the first. Infants should not receive the third dose before 24 weeks of age. Learn more about the benefits of the hepatitis B vaccine for newborns here. How long does it last? According to the World Health Organization, WHO, the complete vaccine series induces protective antibody levels in over 95% of the infants, children, and adolescents who receive it. Immune memory induced by the HBV vaccine can last for at least 30 years in healthy people. That said, studies into the duration of the protection that the vaccine offers are ongoing. These are some of the main information that you need to know about hepatitis B. I hope this information helped you. Please feel free to ask if you have any question about hepatitis B or any other medical condition. Thanks for watching. If you like the video, please consider subscribing.